You know, and today I'm proud to announce that Medicare has selected the first 10 additional drugs for negotiation under the Inflation Reduction Act. 10 additional. Drugs that treat everything from heart failure, blood clots, diabetes, kidney disease, arthritis, blood cancers, Crohn's disease, and so much more. Medicare spends $50 billion a year on these 10 drugs, and American seniors are spending $3.4 billion on out-of-pocket costs. Look, if you compare the total drug price globally, the United States is clearly an outlier. For example, one of the selected drugs that treats blood clots costs about $80 for a monthly prescription in Canada. The same exact drug in the United States, made by the same exact company, costs over $270 a month, made by the same company here in the sold in the United States of America. Triple the cost, just crossing the border. Think about that. Big Pharma charges Americans more than 3 times what they charge other countries, simply because they could. And I think it's outrageous. That's why these negotiations matter. Reducing the cost of these 10 additional drugs alone will help more than 9 million Americans. And by September 2024, HHS, Health and Human Services, was going to publish the prices it negotiated. In January of 2026, the new prices will go into effect. But we're not stopping there. Next year, Medicare will select more drugs for negotiations so more Americans get more savings on life-saving medications they need and deserve. But guess what? Big Pharma doesn't want this to happen, as you might expect. Last year, the industry spent $400 million in lobbying fees to try to stop the Inflation Reduction Act and block the ability of the federal government to lower drug prices. And when they failed, they went to federal court to sue the government in an attempt to maintain their exorbitant prices. They're hoping the courts will do what Democrats in Congress wouldn't do: protect the exorbitant profits and keep negotiations from happening. But we're going to see this through. We're going to keep standing up to Big Pharma, and we're not going to back down.